Good late morning, everyone. My name is Vince Rock, Senior Program Manager at the American Brain Tumor Association. Welcome to the breakout session, Loss of Function, Strategies for Adaptation and Empowerment. Brain tumor patients often face a variety of physical challenges, including mobility issues, speech difficulties, and obstacles in performing daily tasks. This session will explore how physical, occupational, and speech therapists collaborate to address these challenges, guide patients through the recovery process, and work closely with families to promote independence and overall well-being. You will gain insights into the integrated approach that empowers patients to regain function and improve their quality of life. Our speaker today is Dr. Stacy McCarty. She is a physician who specializes in physical medicine and rehabilitation. She has worked at the Shirley Ryan Ability Lab, which is local to Chicago, for 25 years. Dr. McCarty received a discovery grant through the American Brain Tumor Association. You'd think I know how to say it, I work here, to study the impact of comprehensive rehabilitation on function, quality of life, and cost in individuals with malignant brain tumors. Thank you very much, Dr. McCarty, and thank you. Go ahead and get started.
Thank you. Okay. So yes, I'm going to be speaking with you today regarding pretty much an overview of rehabilitation medicine and how it relates to patients with brain tumors. So title of the talk is Loss of Function, Strategies for Adaptation and Empowerment. So it's pretty much trying to help you be the best you can be in terms of function and quality of life. So I have no disclosures. So I am a doctor of physical medicine rehab. Another name for that is a physiatrist. And what it is helping individuals be able to get to the highest level of function that they can. Also helping patients with pain, their disabilities. And as you know, the musculoskeletal system and neurological systems can be involved with brain tumors. So this is definitely a specialty that involves brain tumor patients. And the physiatrist is the leader of the rehabilitation team. So I was fortunate enough to get 2 grants from the American Brain Tumor Association, and I was able to publish 3 papers. And what they were focusing on was looking at comprehensive outpatient rehabilitation in those with malignant brain tumors. And so we looked at cost, quality of life, function, and other measures in this patient population. So learning objectives today are pretty much to show how therapy helps individuals with brain tumors, looking at physical, occupational therapy, and speech therapy, how they work together. Also, different strategies and therapeutic interventions to support the patients through recovery, improving their physical function, and also improving their empowerment. And then the other big thing is collaboration. So collaboration with the therapist, the patient, the whole rehab team. So rehabilitation is very important in individuals with brain tumors. 80% of patients with central nervous system tumors do have rehab needs. And these needs are different in every individual. So as you know, with brain tumors, all the parts of the brain are different. So you have, no one is exactly the same. So the different needs that are addressed in this patient population would be mobility, working on walking, transfers, balance, also self-care, which includes everything to get ready in the morning, getting dressed, washing your face, brushing your teeth, and toileting, working on vision. Vision's key because a lot of people do have visual problems. So with strategies and therapy and the help of eye doctors and vision therapy to help individuals with that deficit. And then communication, which can be broken down into how someone communicates, getting the correct word out, as well as some people may have difficulty coming up with the right word or difficulty with following directions, and that's more what's called aphasia. And then cognition is crucial in this patient population. Cognition is really what makes brain tumor patients different than other people with tumors. If you think about in general, like people with like breast cancer, kidney cancer, so forth, a lot of the big thing for those individuals is pain. In the brain tumor population, one of the major things is cognition. So with cognition, things such as memory, attention, processing speed, higher level deficits too. And then swallow is also important. So all of these rehab needs can be addressed with therapy. So here's the rehab team, very large. So we have, and also, as I should say, the center of the rehab team is the patient and the caregiver or family members. So they're actually part of the rehab team too. So we have the physiatrist, myself, who's the leader of the rehab team. We have physical therapist, occupational therapist, speech language pathologist, the ophthalmologist and vision therapist who work together, nursing, which nursing, I'm not going to be talking a lot on the slides about them, but they are very, very, very important. I mean, the nurses are pretty much the people that spend the most time with patients, and they get to know the patients, the family members, and so they are really important. The social workers help with making sure that you have the correct level of care and all the equipment that you need and all the support that you can have. The orthotist for braces, then your vocational rehab specialist, pretty much for higher level patients that want to get back to work. And then your psychologist, which is also important, and neuropsychologist in this patient population who can do testing to see really where your main deficits lie. So as I said, the patient's family members are very important. They are part of the rehab team. And they can help with you as a patient determine what your rehab goals are. So they can help communicate with the therapist with you to make sure that all your rehab goals are being accomplished. Let's say for you want to, be able to put on your shirt properly, and the therapist isn't really working on that. Well, you want to make sure you work as a